Good morning, everyone. My name is Dr. Fred Ting. I am a medical oncologist from the Philippines, and today I'm very happy to share the lessons that we learned in our Choosing Wisely Philippines initiative. Right. So before I start, allow me to thank Dr. Fidel Rubagumia and all the organizers behind Choosing Wisely Senegal for inviting me to speak this morning and share what we have learned from our part of the region. Again, I'm Dr. Fred Ting. I'm currently the chair of the Clinical Consensus Committee of the Philippine Society of Medical Oncology. So, just a little bit of a background. The Philippines is situated in this area. So, it is located south of China and north of Australia. It is flanked on its right by the Pacific Ocean and on its left by the Indian Ocean. Now, if we zoom closer, you will see that the Philippines is an archipelagic country. It consists of more than 7,100 islands, which is a bit of a challenge in taking care of patients, especially in making healthcare accessible, especially for our patients with cancer. So the country is divided into three main regions. The upper region, which is called Luzon, the middle group of islands, which is called Visayas, and the lower group of islands, which is called Mindanao. Manila, which is our capital, is located in the upper group in Luzon. Okay. So allow me to share just a little uh, background on the timeline of events on how the Choosing Wisely Philippines came about. So December of last year, we received an email from Danny. Of course, we all know Danny Burke is the CEO of eCancer. And that one email pretty much sprung up all the activities that we have done in the country, which we will always be thankful for eCancer. So the email received on December of last year was basically an invitation email, sort of an introductory email about the initiative, about what Choosing Wisely is all about, and that eCancer would be very happy to support such a project in the Philippines. And that one email led to a series of meetings until finally, from January to March this year, um, our society crafted the Choosing Wisely Philippines statements, and it was finally published at eCancer Medical Sciences Journal on July of this year. After its publication, we then proceed proceeded to the part two of the project, which was the Choosing Wisely Philippines Congress. And since August 2022 until today, we have been preparing for this. And this Congress will be on March 24 next year. Of course, all of you are invited. It will be a hybrid event. So we will be having 200 face-to-face participants and unlimited online guests. So I do invite you to join if you have the time. Okay. So this was how our publication looked like in eCancer Medical Science, which was published last July. If you can see, the main authors of um, the paper are all oncologists coming from the different island groups of the Philippines. So because we would want to maximize representation. So now we go to the meat of my sharing. What were our lessons learned from Choosing Wisely Philippines? Um, please remember that the initiative was only launched last month, no, in November, during the annual meeting of the Philippine Society of Medical Oncology. So I might not be able to give you quantitative data in terms of its outcomes, but I will share the lessons learned while doing and preparing and crafting the initiative, right? So, first lesson is that it's very important to learn from the previous experiences of other countries. If you look at the 10 statements that we crafted, there were four new statements that was crafted by the Philippine Society of Medical Oncology, but the six statements were actually revisions of the previous statements by other countries, such as Choosing Wisely USA. And in fact, three statements from Choosing Wisely Africa were lifted and modified for Choosing Wisely Philippines. So it's really important to learn from the groups and from the people who have been there ahead of us, because indeed the lessons that we can achieve, that we can learn from their work are really priceless and would really guide us towards the direction that we are going. Second lesson while preparing for the initiative is that we realize that we are not alone in this endeavor. During our preparations, we saw that the Choosing Wisely campaign is an initiative originally by the American Board of Internal Medicine. And if you go to their website, you would actually see that this initiative is being done by almost all specialties and subspecialties around the world. And it's just amazing and really encouraging to see that. But focusing on oncology, we saw that one of the first groups that made the statements, the initiative, was the American Society of Clinical Oncology. Of course, there's Choosing Wisely Africa. There's also Choosing Wisely Canada and India in cancer care. And of course, I assume all of you have read this commentary by Dr. Rubagumia. And just a couple of months ago, Dr. Rourke actually wrote a perspective paper in the New England Journal of Medicine, where he reflected how the 10 years of choosing wisely to reduce low value care has impacted the countries and the patients where it now exists. So really, you will realize when you do this program that you are not alone, and we do learn from each other, as stated in the first lesson. The third lesson for us is that if your intention is beneficial for the general public, you will definitely receive support from various stakeholders. When during the early parts of the preparation, we were a bit uh, doubtful if this initiative in the Philippines will pick up and will be supported, especially with the challenge of a fragmented group of islands where communication might be a bit challenging to those in the far-flung areas. But we were actually surprised that when this was launched, we received support from medical oncologists, radiation oncologists, gynecologic oncologists, our friends from surgery generalists and other subspecialists, palliative and supportive care physicians from the Department of Health, and even from pharmaceutical companies. And it's just amazing how um, these different organizations support the initiative, because they see that the reason and the purpose of the initiative is basically for the good of our patients. And this is probably one um, lesson that I'd like to share, because if you are planning different initiatives, which is where you are doubtful if people will support, as long as they see that your cause is good, have the confidence to pursue it, because eventually the right group of people would be able to capture it and will definitely support you, right? So fourth lesson is that in unity there is strength. As you can see in what I showed you, um, the archipelagic nature of our country is a bit of a challenge, but thanks to online meetings like this one, we are able to efficiently have our meetings and communicate among all other subspecialties, among all other oncologists around the country. So I'd like to share this paper that we wrote. It was published a couple of months ago, um, entitled "The Geographic Distribution of Cancer Care Providers in the Philippines," where we specifically plotted. No, we gathered data from the different oncologic societies with regards to their members' regional area of practice, and we would plotted and we would want to showcase how all oncologists in the country are distributed per region, per island, to show that there is really a lack of oncologists in the country. And this was the results. For every 100,000 Filipinos, there is less than one medical oncologist, surgical oncologist, radiation oncologist, gynecologic oncologist, and hospice and palliative medicine specialists. If you look at the geographical mapping, we see here that in medical oncology, there are areas that have zero point zero 0.02 to zero point 0.1 oncologists in their area per 100,000 population. For surgical oncologists, there are islands which do not have a surgical oncologist. For radiation oncologists and for gynecologic oncologists, they are pretty much very spread out as well. And for the hospice and palliative medicine specialists, there are a lot of islands which do not have any practice hospice and palliative medicine. So you see here that the challenge is really there, but with everybody's cooperation, then things get a lot better. And with the different projects that we currently have in terms of training generalists, some very important oncologic care, such as diagnosis and screening, then we are able to improve our capture rate of patients with early stage cancer. And hopefully, this would impact 5, 10 years later and increase um, the patient's survival. So here we learned that more can be accomplished by a team with a common goal than by individuals. That's why I'm very happy to see that the oncologists and cancer specialists in Senegal have this meeting because it gives us inspiration and hope to push through with our activities. Because if other countries can do it, then there's no reason that we cannot. Okay? And lesson five, or this is the last lesson I share for today, is that our actions today will greatly impact the outcomes of tomorrow. The Philippines, it's very unfortunate for me to share that a 2019 study showed that only 40% of total cancer spending is funded by the government. The rest is paid by out of pocket payments and private insurance and HMOs. But although the 40% gives a big number, please do realize that this cancer spending only involves basic cytotoxic chemotherapy. Immunotherapy and targeted therapy, and even the oral targeted treatments are not covered by the government. So, with regards to that, it's 100% paid out of pocket or by patients, or if they have insurance and it's partially covered. No? So, this is a number that we would want to improve on, and hopefully in the coming months or years, hopefully months, we would be able to address this because the National Integrated Cancer Control Act, or NICA, which is a law that would cover all 100% of the basic cancer treatments, diagnostic and treatments that the patients need, was signed into law in 2019. However, the crafting of the implementing rules and regulations has been delayed by the COVID-19 pandemic, and hopefully we would see its implementation soon. But even before the NICA will be implemented, The DOH has already launched, our Department of Health or Ministry of Health has already launched the Cancer Assistance Fund for cancer patients. And this provides assistance by funding cancer control services like diagnostics, therapeutic procedures, treatment, and the provisions of cancer medicine. However, although this is already one good step, unfortunately, this still does not cover targeted treatments in immunotherapy, and that is what we're currently working on. But we're very, very happy that eCancer approached us, communicated with our society at the right time, because now our Department of Health and the government would be using these guidelines, these statements to not provide low value care and to make sure that we are using our limited resources, our limited funding and manpower efficiently. All right? So here we see that great things really come from small beginnings. And um, it's just very inspiring for me to share how one single email from Danny Burke has led to this initiative and to these campaigns now in the Philippines. That's why I think another lesson here is that please do read your emails. But kidding aside, we are very, very thankful to eCancer for reaching out to us and for helping us um, push through with the Choosing Wisely Philippines campaign. So this is the organ, well, not all, but probably 70 to 80% of the organizing committee of Choosing Wisely Philippines, where we had a general assembly last month in preparation for our Congress for next March. And before I end, allow me to share a video invite. And it also have a picture where which you can scan to see the publication that we have. All right, so feel free to scan this picture so that you can, if you'd like to see our publication, it directs you um, towards the paper. So once again, my name is Dr. Fred Ting, and thank you for allowing me to share our lessons learned from Choosing Wisely Philippines. Maraming salamat po, or in English, thank you very much. If you do have questions, feel free to email me at f.ting@usls.edu.ph. I really apologize. I cannot join the Q&A session because I am in another conference meeting, but feel free to email me if you have questions or concerns or comments, and I'll be very glad to reply. Right? So thank you very much. And once again, thank you, Choosing Wisely Senegal, for having me.